This is going to be a joint presentation. Sister Bina and myself will be doing this together. Our intention is not to teach much of theology, but our intention is to share with you our experience of our journey in this ministry, healthcare ministry, especially in the context of this COVID pandemic. This is a noble ministry, all of you know, but this is also a challenging ministry. So, in our journey in this ministry, we make sense or we find some meaning through some of the scriptural and theological principles. So, that is what we will be presenting to you today. Maybe we could call this a little bit of contextual theology. There will be elements of systematic theology, maybe moral theology, but more of missiology and a little bit of feminine theology, and probably some amount of psychology and sociology. So that will what you hear from us today. When we were thinking of a title for this presentation, we felt that it is good to give this title, Lumen Gentium, Light of the Nations. Most of you are familiar with this Vatican document. The church is mentioned as, or church is projected as the light of the nations. As we go through this presentation, probably you will understand why we are using this title. And God said, "Let there be light," and there was light. Genesis chapter 1. This talks about creation. I am the light of the world. He who follows me will not walk in darkness, but will have the light of life. The words of Jesus. Jesus, the Redeemer. So creation, redemption. You are the light of the world. Let your light so shine before men that they may see your good works and give glory to your Father who is in heaven. Again, the words of Jesus. We all know that the act of redemption is not just a one-time act, it's an ongoing process. And God somehow, maybe because of mysterious reasons, God wants us to be part of this redemptive process. And He says that you are the light of the world, and let your light shine. Let the world see the glory of the Father who is in heaven. God wants us to be part of this journey as individuals and also as a community, as a church. And there I quote from Lumen Gentium. The bishop says, the synod says, the council says, we desire to bring the light of Christ to all men, all people, a light brightly visible on the continents of the church. The face of the church. What is this face of the church? The face of the church is a reflection of the face of God. And it should be the reflection of the face of God. And we all know that the face of God is a compassionate face. And at the core of the reason why the church exists is for a mission. And at the core of this mission is love of God and love of neighbor. We know we all experience love of God through sacraments, through word of God, through prayer, various means. But at the same time, we know that there are millions and millions of people in this country who do not have access to sacraments, who do not have access to the Bible or scriptures. And how do they see the face of God? They see the face of God in a concrete way, through concrete expressions of love of neighbor. They see the face of God. They experience church, they experience God through the merciful, compassionate act of the members or our concrete actions of love of neighbor. There are different ways the church expresses love of neighbor in a concrete way, and healthcare is one of them. We know that church have 4 ways of expressing love of God, love of neighbor in church as a community, in an organized way. Healthcare, education, social work, and pastoral care. So today we are going to present to you from the perspective of healthcare, how this love of neighbor, how this light of Christ, is made visible to the nations, to the people through works of mercy, to works of compassion, through healthcare. Healthcare is a ministerial instrument of God's outpouring love for the suffering person. And at the same time, it is an act of love of God shown in the loving care for the person. For the Christian, it is an actualized continuation of the healing love of Christ, who went about doing good and healing everyone. Healing mission was integral to the mission of Jesus. Healing is integral to the kingdom of God. This quote is from the Charter for the Healthcare Workers, a document Vatican came out in 1994. Well, I will invite Sister Dr. Bina. Father Joji introduced her very well in the beginning. So I invite Sister Dr. Bina to share the journey, the COVID journey they went through. She went through as an individual, as a sister, and also the journey they went through as a hospital, in the Chai network. Over to Sister Dr. Bina.
Thank you, Father Matthew, for setting the context. Good evening, one and all. My COVID journey is a presentation through which I would like to illustrate my own experiences with COVID patients, as well as the frontline warriors. It has been a journey filled with uncertainty, challenges, fears, and trials. It was also a fulfilling experience for me. Managing this new disease posed a lot of administrative hurdles, operational challenges, clinical dilemmas, and financial constraints. Understanding the signs of the time. You know how to interpret the appearance of the sky, but you cannot interpret the signs of the time. Matthew 16:3. Jesus was talking about the deeper understanding of the signs of the kingdom. So how and when did we understand the signs of the time? When the coronavirus crossed geographical boundaries and spread to newer territories, it set an alarm tone within myself. The horrifying news reports from China and Italy and other countries disturbed me, as I could foresee what is awaiting us in India. I was also not so sure how we are going to manage the magnitude of this pandemic crisis, given the Indian socio-economic context and fragile healthcare system. When we look at Indian healthcare system, we see here we have a wide gap between the poor and the rich, the rural and the urban. The profit-oriented medical treatment is offered by our corporate hospitals. There is also fragmented medical supply chain and acute shortage of trained medical personnel. With all these thoughts, I was perplexed. How can I offer, amidst such a scenario, compassionate, affordable, quality care to the common people affected with COVID? So this is how I understood the signs of time. Overcoming my fears. The mission that God entrusts to each one of us leads us from fear and introspection to a renewed realization that we find ourselves precisely when we give ourselves to others. This was the message from Pope Francis for the World Mission Day 2020 in the context of COVID-19 pandemic. So my fears began to melt away as few other members from the management committee of our hospital, Holy Family Mumbai, also recognized that Corona is going to be a major pandemic and would severely affect our country, especially Mumbai city. We had several rounds of meetings and discussions to plan and prepare. Intense training sessions were conducted across the hospital to all strata of employees, from doctors to the housekeeping staff. Somewhere in mid-February, we also thought of procuring the PP, which we actualized after a month. We procured personal protective equipments and other hygiene products. A designated team was appointed at that time to prepare the standard operative procedure for COVID-19 ward management, and also to prepare the clinical and treatment guidelines. Creating isolation facility was a Herculean task, as we had to adhere with a lot of government guidelines. So it took almost 1 month for us to prepare the isolation ward. Can I have the next slide? Emotional stress and physical fatigue. I sink deep mire where there is no foothold. I have come into deep waters and the flood sweeps over me. Psalm 69:2. David penned this psalm when he was in affliction. Often, when I was experiencing emotional stress and physical fatigue, I could identify with psalmist. As all of us are aware, there is a lot of fear and stigma associated with this illness. The patients are worried, distressed, and fear-stricken. It demands a lot of energy and efforts to listen to them, to reassure them, and to comfort them. Similarly, the relatives of patients are anxious, tensed, and are panicking. Often, we have to spend hours talking to relatives to update them about the patient condition. Often, in the late evenings, I return to my room, emotionally drained and physically exhausted. At one point of time, several caregivers contracted the illness in my hospital, doctors, nurses, and other employees. Their sickness shook me. On one hand, the worries about their well-being, and on the other hand, the fear of contracting the illness. Even managing the caregiver's parents was very difficult, especially the infected nurses' parents were having numerous questions, and we had a very tough time to manage them and to calm them down. There were times we had to refuse admissions due to non-availability of beds. Unfortunately, those occasions were pressurized. We were pressurized by some of media houses and activists. This was not only stressful, but the misinformation and biased partial truth fed through the newspapers and social media had a negative impact on our personnel who are dedicated even beyond their call of duty. Society may call us COVID warriors or COVID heroes, but it's extremely sad that the doctors and the nurses and other medical staff who are the frontline warriors in the fight against pandemic are at the receiving end of threatening calls from the activist and agitated relatives. None of you may know what is the difficulty in wearing the personal protective equipment. Wearing of PP, the N95 mask, goggles, and face shield gives a suffocating feeling to most of us. Many times, there is misting of protective goggles, which causes blurring of vision. After donning, one cannot eat, drink, or even go to washroom, and every duty shift is 6 hours or more. We have to speak loudly in order to be audible, and it becomes very tiring to communicate with patients as well as other members of medical team, resulting in frequent fatigue. In addition to this, a lot of information has to be given to the patient's relatives who are unable to come to the isolation ward. All of you are aware that Mumbai weather is very hot and humid, that we get drenched in sweat within few minutes of wearing the personal protective equipment, which makes it even more difficult for us to move around. With all these difficulties, most of us felt compassion fatigue and burnout. Can I have the next slide? Financial challenges and God's providence. And God is able to bless you abundantly so that in all things, at all times, having all that you need, you will abound in every good work. 2 Corinthians 9:8. Saint Paul wrote this to the rich church of Corinth while he was constructing the poor church of Jerusalem, and he was having a collection from Church of Corinth. Initiating all this COVID-19 treatment and preparations incurred a lot of unplanned and new costs to the hospital. We had to procure the personal protective equipments, the sanitizers, and other hygiene products. That was the time there was shortage of supply, and the vendors increased their prices exponentially. We also had to shut down few of our departments, especially our regular OPDs, elective surgeries, chemotherapies, and diagnostic procedure, as we had to make a lot of makeshift arrangements in the hospital. There was the time hospital experienced severe financial crisis. We had a revenue loss of up to 70%, and the operational cost escalated by over and above 40%. And we had really a tough time to pay 1,000+ employees of the hospital. At the same time, the government of Maharashtra also capped the charges of 80% of our beds. So it added the financial burden. But this was also a time when we experienced the divine providence as we received generous support and donations from institutions, churches, benefactors, and well-wishers. Next slide. Can I have the next slide?
It's there, sister.
Yeah. Accompanying the caregivers. Therefore, encourage one another and build each other up, just as in fact you are doing. 1 Thessalonians 5:11. These verses encourage the Thessalonian Christians to be active, alert, and purposeful in their Christian life in the face of persecution. There were numerous teething problems as we started to operationalize the isolation ward. Motivating the caregivers was a difficult task. We had to have several rounds of meeting to listen to them, to motivate them, and to encourage them. We also involved a counselor to address and deal with the fear and stress factor of our staff. A few of the staffs were given letter of appreciation as an incentive for their outstanding work and contribution. In fact, I handheld many of our junior doctors, accompanied most of our intensivists and consultants, as all of us were going through a tough time. In the process of it, few of them contracted the illness. We sisters closely followed them and took care of them with so much love and understanding. These kind gestures from the sisters actually increased their loyalty towards the hospital, and they are back again with renewed commitment and dedication. Positive outcomes. He that goes forth weeping bearing the seed for sowing, shall come home with shouts of joy, bringing his sheaves with him. Psalm 26:6. The psalm was composed with reference to the return from Babylon. In the process of treating these COVID patients, we had so many positive experiences. Despite all these difficulties, each time when a patient recovers, each time a COVID positive mother delivers a baby, we all experience a moment of joy, affirming the powerful presence of the divine healer and his miraculous healing touch. So far, we have treated around 1,200 COVID patients at our hospital. Even today, we have around 125 COVID positive patients, around 30 suspected patients in the suspected ward, and of which 28 of them are on ventilator. Each recovery and discharge is a rewarding moment for the entire medical team. It lifts our spirit and motivates us to work better. Opening our hospital with COVID facility also improved the patient satisfaction, and indirectly it has improved the reputation and visibility of the hospital. As I mentioned, we experienced a lot of goodwill from friends, well-wishers, and benefactors. There is a sense of fulfillment and joy in all these struggles, especially when we save a life. I could very vividly remember one of my experience. A patient in his mid-50s was brought to our emergency one day with a history of breathlessness. His oxygen saturation level was only 50%. Our intensivist revived him in the emergency, kept him on oxygen therapy for some time. As we did not have a critical care bed that day, we were trying to shift him to another hospital, but the patient refused to go. He waited in the emergency the whole night, and the next day, when we got one bed vacant in our critical care, he was shifted to the critical care unit. There he was on ventilator for almost 15 days, but after a stormy period, he recovered. After his discharge, he came to my office with folded hands and with tears in his eyes to thank me for giving a bed in the critical care. It was such a moment for me. It has etched such a lasting impression in my mind and heart. I can never forget it. So I'm sure all of you agree that the joy of saving one life is a feeling much beyond any other joys in life. Self-care for sustainable leadership. Come to me, all you who are weary and burdened, and I will give you rest. Matthew 11:28. Every healthcare worker at the forefront of the war against corona not only is facing the daunting task of handling patients, but are also facing compassion fatigue and burnout. So these are few measures which has helped me to sustain myself and to carry on. It's important to rest and have at least 7 to 8 hours of sleep daily. Besides taking a nutritious diet, I'm on vitamin C and B complex supplement and on hydroxychloroquine prophylaxis for the past 5 months. It's equally important to keep ourselves physically and mentally fit. After a stressful day, I go for 30 minutes walk, which refreshes me. Coming together for community dinner is also a wonderful experience and a relaxing time for all of us sisters. To a group like this, I need not share the importance of prayer for spiritual nourishment. Time spent in silence, reflection, and prayer gives me a lot of peace and serenity to sail through. I begin my day surrendering myself to God. I seek His guidance, wisdom, and strength. After an exhaustive, long day, sharing with your colleague or chatting with your friend also helps me to unwind. the supporting words, the words of appreciation and encouragement which I receive from my friends and sisters from different parts of my congregation is acting as a balm of comfort. In short, a positive attitude and a proactive and generous mindset enabled me to be hopeful and to keep going. I would like to conclude this presentation by quoting St. Paul. We are all in this struggle together, Philippians 1:13. I have just shared my experience working in Mumbai Holy Family Hospital, which is a member institution of CHAI. Catholic Health Association of India is the larger family. So now I would like to invite Father Matthew, the Director General of CHAI, to present his views. Over to you, Father Matthew.
Can you hear me? Can you hear me?
Yes.
Yes, sir, yes.
Yeah, thank you, Sister Bina, for this wonderful presentation. It was indeed very moving. Okay, now I move on from here. Sister Bina spoke about the work of one of the hospitals in Mumbai. Now, we have around 65 of our hospitals, institutions involved in COVID care when we prepared this presentation. So every day this number goes up, and as of now it's more than 70. And you can see the breakup there. We have different levels of care, COVID care centers, dedicated COVID hospitals, designated COVID health centers, quarantine centers, and so on. Altogether, there are about 65. And you can also see the breakup state-wise and also region-wise breakup there. Now, CHAI as a family, as an NGO, as a network, responded to COVID crisis right from the beginning. Of course, COVID threw us off the track for a while, but we could somehow recoup and make a difference. Now, our involvement were at different levels. Our initial relief work were related to socioeconomic support. This was a group of people, the migrants who lost their jobs and walked kilometers, hundreds of kilometers back to their villages. So with the support of 7 of our existing funding partners, we are supporting 3,250 families in 17 states, and most of the support is for 6 months. And we have 56 of our member institutions as implementing partners. You all know what it means when we really don't know where we could get the next meal from. So there are so many families which are suffering. We are able to help them in a small way by providing. And most of these families are vulnerable families, either those who are migrant laborers or those who have families of widows or families with children with disability and so on. We used innovation, a geotagging app, in order to promote transparency and integrity in implementing this project, so that we could show to our donors where these food kits are distributed, real-time data, which place, which date, which time, and so on. I'm not going into the details of that because of lack of time. The other areas where we were involved in was supporting our member institutions, our hospitals, to prepare them for this COVID crisis. So we are also aware, Sister Bina spoke about the importance of protecting the caregivers, the PPE kits. So we are supporting 49 of our hospitals as of now with this PPE kits. Our needs are much more, but this is what we could do, given the kind of constraints which we have. We also have a help desk here, which supports all these 65 institutions or 70 institutions which are involved in COVID care. So they call us, they mail us. We have a dedicated person who contact them on a regular basis and help them to handle this crisis. We have a capacity building program going on as part of a CHAI Academy. It's an online academy. We have several webinars. The initial webinars were to help these hospitals to learn from each other, so we could, so that they could support each other to prepare for this crisis. After that, we also started webinars for long-term sustainability of our institutions. We have some online courses that are going on with University of Melbourne, CMC Vellore, and so on, for doctors, for nurses, for those who are in community work, or those who are into the field, those who are reaching out to the community. We also, and one of the courses for administrators, helping them to learn how to handle this situation. Let me quote from Pope Francis here. The message he gave for the World Day of the Poor in 2020. Now is a good time to recover the conviction that we need one another, that we have a shared responsibility for others and the world. He spoke in the context of the COVID crisis. Well, chai, a little bit about chai before we conclude this presentation. Chai was started in 1943 by 16 daring sisters under the leadership of Sister Dr. Mary Glowry. Mary Glowry was an Australian. She studied at the University of Melbourne. She did her MBBS there, did her post-graduation there, and she came to India to help this, especially the women and children in this country. After reaching here, she joined the JMJ sisters and continued to stay in India till the end of her life. After 77 years of the founding of CHAI, even today, this organization remains predominantly as a women's organization. 90% of the CHAI institutions are managed by sisters. Today, you heard the story of Sister Dr. Bina. Well, this is where I said there is a little bit of feminist theology we would like to highlight here. A quote from Mulieris Dignitatem, the document from St. John Paul II. The moral and spiritual strength of a woman is joined to her awareness that God entrusts the human being to her in a special way. Well, we all know that God entrusted all of us to our mothers, right from conception. She carried us in her womb for 9 months. She dandled us on her knees. She carried us on her hip. She suckled us. And that's how God entrusts every human being into the special care of a woman. Now, when we talk about the sisters, there are women who become mothers, physical mothers. But when we talk about the sisters, they are women who have given up the choice of becoming a physical mother, but have decided to become mothers of larger family, for the sake of the mission. And this is very, very important, especially in the field of healthcare. We know that predominantly this is a ministry that needs a lot of compassion, a lot of humanness, and women are gifted with that, and that's the way God has created them. Maybe that is why more women become part of this noble but difficult ministry. At that time, Mary got ready and hurried to a town in the hill country of Judea. We know that Mother Mary, as soon as she heard from the angel that Elizabeth is with the child, she leaves everything and she goes to take care of her. I could see a similarity between Sister Dr. Mary Glowry and Mother Mary. Here is Dr. Mary Glowry, an Australian. She came to know about the plight of the pregnant mothers and the children and the women in this country, and she read it from a pamphlet written by another missionary called Agnes McLaren, who worked in India. So she decided to study gynecology as post-graduation, and as soon as she finished that course in 1920, she came to India. Those days, they had to travel for months on a ship to reach India. And this year, we celebrated the 100th year of Mary Glowry's arrival in India. Also, we celebrated on 29 July, the Foundation Day of CHAI, 77 years of its existence. Let me come to CHAI as a network. You can see the numbers there. As a network, as an association, we are 3,572 member institutions. Most of them are small health centers managed by sister nurses. These are places where doctors will not go. You know, those who are from Kerala may not understand the context, this context, because when you cross the borders of Kerala, you will see what this country is like. There are about 50,000 nuns who are qualified, sisters who are qualified in healthcare. About 1,000 of them are sister doctors, like Sister Bina, and more than 25,000 of them are sister nurses, and the rest are paramedicals and social workers who make the face of God, face of the church visible to people who do not access to sacraments and gospel. Altogether, about 21 million patients are cared or go through our network, and 80% of these members, the small health centers, are located in remote, medically underserved area. That is why I would like to quote this from St. Paul II. The address, when he went to Canada in 1987, he addressed the leaders of Catholic healthcare like this: "You proclaim to your fellow citizens and to the world Christ's special love for the neglected and the powerless." No, we becoming the light to the nations, to the people. Let me come to CHAI as an NGO. As an NGO, we are involved in several projects, but our focus areas are children with disability, children with HIV/AIDS, palliative care, people are dying of terminal illnesses, palliative care, and community health is also a focus for us, developing the villages.
Excuse me for Matthew.
Yes.
It's getting time. Yeah.
Can you hear me, Father?
5 more minutes. Yes, 5 more minutes, please.
All right. So, so here we are talking about life does not have a mission, but life itself is a mission. What do I mean? Sometimes we have a tendency to consider theology and life, or life and ministry, as two different things, but it has to be integrated. A rich inner life should lead to a ministry, and a ministry should enrich the inner life. So as priests and brothers, if you are able to go through these kind of experiences, it will help us to become very good pastors, compassionate pastors. Often when we come to the pulpit and preach to people what we have learned from the classrooms and the textbooks, we may not realize that in the congregation who are listening to us, there may be a family who is sitting there who has a child with a disability. They may be much more compassionate, much more loving, much more patient than we ourselves. The same with the story of people who suffer with terminal illness. So it's very important for us to be exposed to these kind of realities as part of our formation. Well, the CHAI Vision 2030 speaks about compassionate, affordable, and quality care at the margins of the society. And from Evangelium Gaudium of Pope Francis, I say that the church has to go forth to everyone without exception, but above all, the poor and the sick, those who are usually despised and overlooked, those who cannot repay. This is my last slide. So what did we try to do? We were trying to find meaning in this noble but challenging ministry through some of these principles from scriptures and theology. And these are the major themes we focused on: light to the nations, theology of suffering and healing, the special dignity of women, and the anavim of Yahweh, the option for the poor. Thank you. I would like to thank Mr. George, who is with us as a panelist, as a silent listener. This was a joint work we did together, Sister Bina, myself, and George. And Sister Bina and myself, we are quite busy with our day-to-day commitments. So George took a lot of time to help us to identify these principles and these documents. So I would like to put on record my gratitude to George as well. And thank you once again, Father Georgie, for giving this opportunity. Thank you all.